The case of obstructive cardiomyopathy. In this image, what you see, this is mitral valve, and during the systole, the whole mitral valve moves towards interventricular septum, causing flow obstruction. That is subaortic dynamic flow obstruction. Dynamic because it is changing with the heart rate, with the power of contraction, the obstruction changes. So that is why it is called dynamic. In this image, now see how just see, this is diastole, now systole, now this is systole, and then this is systole, this systole, this. So what happens here? Whole mitral valve moves towards interventricular septum. Just see, this is systole moves. This is the whole mitral valve has moved towards interventricular septum, causing flow obstruction in subaortic region. You see, this is the LVOT. This is left ventricle. This is aorta. So you see, this is left ventricular outlet. This is mitral valve that has moved towards interventricular. This is left ventricle. You can just see. So what happens? You see systole in this moment. When the mitral valve closes, systole has started already. You see, the whole mitral valve moves towards interventricular septum. Whole mitral valve moves towards interventricular septum. That is called SAM, systolic anterior motion of anterior mitral leaflet. Basically, you see a whole mitral valve, mainly internal mitral leaflet, that moves towards interventricular septum. But in this case, what you see, this in posterior wall is less thickened compared to interventricular septum. So here the DD is what? This is the case of obstructive cardiomyopathy. It may be hypertensive obstructive cardiomyopathy. A second is hypertrophic obstructive cardiomyopathy. As the patient is very old-aged lady, the likely scenario is it may be hypertensive obstructive cardiomyopathy. History of hypertension was there. So now you see this interventricular septum is more hypertrophy at the base only. Rest portion is not that much hypertrophic. So maybe it is hypertensive obstructive cardiomyopathy as a history of hypertension there, but significant flow obstruction in subaortic region. Next image, you see again the same thing. You can easily see how the whole valve touches, then moves towards the interventricular septum. This touches, moves towards. This is SAM, sensory anterior motion of interventricular. Listen. You see flow turbulence in that region. See the most turbulence where the SAM is, there is flow turbulence. You see, this is the flow turbulence area. I can see the same thing. This is apical fourth chamber view. Here you can see the color turbulence. This is the part where turbulence, you see the color turbulence. The scale is very 91 centimeter per second. 91 centimeter scale is. Still you can see the color turbulence indicating flow is much more in velocity. Where the obstruction starts, you can see the subaortic region has color turbulence. So it is subaortic dynamic flow obstruction. Again, you see the SAM. Whole valve closes, then moves towards. You see the whole valve closes, then moves towards intervenous septum. Closes, then moves towards intervenous septum. You can see this one, the intervenous septum. So this is intervenous septum. This is intermittent leaflet that has moved close to intervenous septum, interventricular septum. SAM in parasternal long axis view. Ejection fraction is quite good. You see the ejection fraction in this image. SAM. Here you see the PMN has got focal calcification. So old age lady showing you focal calcification of posterior mitral leaflet. You can see the good contraction of left ventricle. So this case has got hypertrophic. This case has got obstructive cardiomyopathy, and differential diagnosis is either hypertensive or hypertrophic obstructive cardiomyopathy. If base region is only has got localized hypertrophy, then chances of hypertensive obstructive cardiomyopathy and basal septal hypertrophy. So DD is only two things, either hypertensive obstructive cardiomyopathy or hypertrophic obstructive cardiomyopathy. I want to show you the gradient. So you can see the thickness. Pressure gradient is here. You can see this is 57 millimeter of mercury, velocity by 3.76 meter per second. So quite high velocity. This is probably jet of MR jet, because whenever AML has SAM, there is little bit MR also, eccentric MR due to SAM. In this image, you can see this is eccentric MR jet here. This is eccentric MR jet. You can see eccentric MR jet also. This is eccentric MR jet. So with SAM, you will also see the eccentric MR jet. Sometimes velocity of MR is measured, and that is written as subaortic flow obstruction gradient. That should be avoided. That is the point to learn. So whenever you put your cursor, you have to see that your cursor does not touch MR jet. Otherwise, your gradient will be falsely very high. So that is the point to learn. So whenever you put cursor across the highest turbulent part, you have to remember that that should be within left ventricular outlet region, not within left atrium. Remember this thing. So this is the case of obstructive cardiomyopathy, either hypertensive or hypertrophic. As the lady is old aged, patient is old aged lady, so maybe hypertensive obstructive cardiomyopathy. Thank you.